A nationwide crackdown on Medicare fraud has reached Florida. Federal prosecutors are announcing charges against nearly a dozen people across Central Florida.
The schemes targeted taxpayers and some of the nation's most vulnerable patients. 10 Tampa Bay News reporter Kristen Barbarisi explains how prosecutors say those scams worked.
Officials say these were not isolated scams, but coordinated fraud networks that exploited Medicare in multiple ways, including unnecessary wound care and COVID-19 test kits that patients never asked for. Federal prosecutors announced charges against 11 people tied to 8 Medicare fraud cases in the Middle District of Florida. Among them, a scheme involving more than $118 million in fraudulent wound care claims. Prosecutors say Medicare paid about $61 million for medically unnecessary skin grafts that were never used or were applied in inappropriate situations. They also outlined COVID-19 testing schemes where investigators say Medicare beneficiaries received test kits they never asked for. One case alone involved 152,000 fraudulent claims, totaling more than $14 million.
Healthcare fraud is not a victimless crime. These schemes steal from taxpayers, divert care from patients who need it, and all too often put beneficiaries at risk and threaten their well-being.
Prosecutors also charged a Pasco County attorney, accusing him of stealing more than $300,000 from clients who had already obtained the money through Medicare fraud after promising to hide it from the IRS. These efforts were part of a broader nationwide crackdown on healthcare fraud, which resulted in the arrest of 455 people, including 90 doctors. Reporting in Tampa, Kristen Barbarisi, 10 Tampa Bay News.